All right. So, hello. We have Dr. Mike Iseman of Wichita Pediatric Dentistry, and we are so excited to have him here to share about tongue and lip ties. That's something that we see in the Wichita Mom neighborhood and community groups, a lot of questions surrounding that. So, Dr. Mike, we're really excited to hear what you have to say, and Jenny has some questions. And if anybody has additional questions, please feel free to ask in the comments below and we can address those.
Thank you for having me.
Yes.
We're so glad you're here. We get questions all the time about pediatric dentistry in general and what we're wanting to talk about today, which is lip and tongue ties.
Sure.
And my first question is just, what is a lip and tongue tie?
Very good question. Many people think their child has a lip or tongue tie that may not actually have it. Anatomically speaking, all babies and all humans have attachments inside of their mouth, and those are normal. But if they're restrictive and cause symptoms, functional problems, that's when the tie is diagnosed. And so lip or tongue tie is a restriction inside the mouth of a tie.
Okay, so who diagnoses that? Is it your pediatrician, a dentist, a lactation consultant?
Well, the doctors are the ones who are in charge of diagnosing it, but many times, a lactation consultant, speech therapist can help also diagnose, but a lot of times they'll just alert a parent to the possibility of something going on, and they will refer to the doctor to do the diagnosis. And so that's, in my office, I'm the one that diagnoses, obviously, and I get referrals from lactation consultants and sometimes from other doctors as well.
Okay, great. How young are you seeing children to have lip and tongue ties released?
We released lip and tongue ties on age 0 to 16, basically. Generally speaking, unless it's an extreme tie, we're going to wait till the baby is 5 to 7 days old before we would intervene, because a lot of times it's just because they're young and they're new. But many times if we can catch it when they're babies, we can help them to feed better and prevent a lot of downstream problems rather than addressing it when they're older.
Absolutely. What is the process? How do you in your office release these ties?
Yeah, and in our office, we're fortunate to be able to utilize the latest technology in a CO2 laser. It's very gentle and less penetrating than other types of lasers, and it's less discomfort experienced by the patients. And during the procedure, as well as for healing, it also ensures that a very precise cut is made, or release is made, if you will. There's no cutting involved, actually. Nothing's touching the tissue, which helps to prevent any infections and also collateral damage. Minimizes bleeding as well. So it's wonderful for the clinician because it's simpler, but it's obviously very good for the patients, especially these little babies.
Absolutely. What does the recovery look like, especially in those little ones?
Yeah, the little ones handle it very well. I mean, you probably know that they handle things a lot better than us adults anyway. Fortunately, babies and kids heal quickly and mouths heal quickly. We always expect that no matter what age we do this on, you're going to have a little bit of irritability, 24 to 48 hours of cranky baby. But many times the baby's are already cranky because of the tongue tie contributes to so many issues. And so many of those parents tell us they really weren't that cranky, but they did notice they might have a little bit of discomfort for 24 to 48 hours. And then they pretty well get over it pretty quick after that.
Great. What are
I thought of one question too, actually,
Yeah.
Dr. Mike, as we were chatting. So for moms who may have no idea what we're even talking about in terms of tongue and lip tie, can you speak at all to how would someone even know that this may be something that they need to look for? Or I guess what are some of the side effects of having a tongue and lip tie?
So what we use in our office, we screen when we suspect that there might be a tongue or a lip tie, or if somebody has obviously been sent to us for that, we use a screening form. And the screening form has all the signs and symptoms that they might notice. Now, we don't have to have all of them to intervene. But what I always stress to parents is it's not what the tie looks like, it's what the symptoms are. And those symptoms, what you just asked about, many times can be have to do with colicky baby, gassy baby, baby that spits up frequently, baby that leaks around the mouth when they're trying to feed, have poor latch, they have blisters around their lips. Moms might experience extreme pain or just pain in general when the child's feeding. Many times if babies are considered lazy nursers or they fall asleep, they get fatigued feeding because they have to burn so much energy in order to actually get milk, or they're choking and gasping a lot because they have a difficult time stopping the flow from mama who has good letdown. So all of these are symptoms of the tongue tie because the tongue's not able to function like it's supposed to. Mm-hmm. Lip tie is what you might see as a lip that curls inward while mom's trying to nurse. That also inhibits the lip seal and causes more leakage as well. So when we see any of these symptoms, we are suspecting that there's probably lip tie, and then we can identify that and show parents that when the baby's in our office.
Great. Awesome. Jenny, did
those are just some of the ones I could think of off the top of my head.
No, that was really good. And we on the Wichita Mom team, we've had moms experience exactly what you said. And ultimately, typically, I feel like a lactation consultant has been the one to bring it up. And then the next step would be to, of course, call you, and then you can further identify, if there really is an issue there. So.
But I mean, and I'm not the only person that does this, but I would hope that if somebody suspects it, whether it's mom or lactation consultant, that you find somebody who is knowledgeable in finding out what's going on and can help. Because I think a lot of times it's dismissed, and then moms feel frustrated because they can't find answers and they think they're crazy. And you're not crazy, mom. It's not going right. Keep searching, because we want to help moms who want to nurse. I mean, it is natural. And even if a mom says, I'm not really going to nurse, I got to return to work, or I only want to do it for a little while, that's fine. If your baby has a lip or tongue tie, it's going to affect bottle feeding as well. And you can still have many of those symptoms. And then it's just baby. Mom may not be hurting, but baby's having struggle with the gassiness and that kind of stuff. So it's still helpful.
Yes, definitely.
We've talked about a lot of these benefits related to feeding. Are there any other short-term or long-term benefits that you can expect to see if you rectify these ties?
Sure. I mean, long-term, we're looking at, I will never treat a baby just for later on issues. However, when we do have symptoms as a baby, you're also hopefully going to prevent future problems with feeding as well, because we see a lot of kids who have difficulty manipulating different textures and types of foods as they start to get older, and they have poor habits because of that. And sometimes we just think of them as just almost annoying eaters, but a lot of times they don't have any other choice. They don't know any better, and that's their way of protecting their airway, or actually figuring out how to swallow a certain type of food. Speech is a big one, and it's even debatable, and it's coming into more acceptance, if you will, among speech therapists too, whether or not a tongue tie even affects speech. And I'm not a speech therapist, but it just seems to me as a dentist working in the mouth that, I mean, I don't know how speaking, if your tongue is not able to function properly, how it doesn't affect it. And so, that is a controversial subject, but it is definitely something you want to look for if your older child is having issues. And so if we take care of it when they're younger, they can sometimes prevent that.
Great.
Great.
Awesome. Well, that's such great feedback and perspective, Dr. Mike. We really appreciate it. And one last thing, how can anyone who's attending contact you if they have any questions or are interested in learning more?
Sure. I would tell you, first of all, you can reach us on our website. You can search, among the pages, and you might find some more information there. But otherwise, you can see it at driseman.com, driseman.com, or you can always just reach us on our phone number, 316-630-0090. We're happy to see any child that moms suspect might have an issue, and certainly always encourage the new moms, especially, to visit the lactation department or have lactation assist you in that first couple of days. And if there's any issue, sometimes you have to be the persistent mom and be an advocate for your baby. If they're denying it or dismissing it, just know that if you suspect something, find somebody who knows that they can help.
Awesome. Great. Well, thank you so much. And we will talk to you soon.
Thank you.
Thanks, Dr. Iseman.
You bet. Good to talk with you, ladies. Bye-bye.
Bye.